can't afford health insurance. They can't afford car insurance. They can't afford rent. They can't afford to buy a house. Those are the problems we need to be fixing.
Let's see. My life sucks. I don't have a job. I don't have any money. I can't afford to pay any of my bills. I most likely have crippling anxiety and depression. I have no friends, and nothing is going my way. Who should I blame? The rich, corrupt assholes who are stealing and squeezing every penny out of this economy, and the government who works for them, and the politicians who are screwing me over. Nope. It's the immigrants. That random Mexican guy working a $10 an hour construction job. That single mom on welfare. It's their fault. Nailed it.
Bro, the oldest trick in human history, and it still hits every single time. Here's the thing nobody wants to admit. Misdirection isn't accidental, it's engineered. Keep the working class furious at each other. And nobody's looking up at who's actually picking their pockets. The $10 an hour construction worker didn't price you out of your house. He can't afford his either. Billionaires don't fear angry people. They fear focused people. There's a massive difference between those two things, and that difference is worth about $1 trillion a year to the right people.
3 prescription medications I would never take unless you can convince me otherwise. I'm pharmacist Steve Hofford, and those who want to understand medications, follow us. Here are 3 of the most common medications taken by patients daily that as a pharmacist I don't ever want to take, and a root cause approach that you can use as an alternative. First, non-steroidal anti-inflammatories like ibuprofen, naproxen, and Celebrex. These wreak havoc on your gut and cause leaky gut and drive up inflammation long term. Cause kidney issues. Why do you think there's so many dialysis places nowadays? And finally, they destroy cartilage, which leads to lots of knee replacements and hip replacements, so I don't really want to take those.
Okay, technically he's not wrong, but here's what this advice is missing. Root cause medicine costs money. The functional doctor, the anti-inflammatory diet, the physical therapy your insurance won't touch. That's a privilege, not a universal option. For a huge chunk of America, ibuprofen isn't a bad choice. It's literally the only choice left after the insurance denial letter arrives. Great advice for people with options. For everyone else, they're just trying to survive Tuesday.
Next, I would avoid PPIs like omeprazole and Nexium at all costs. Yes, these block stomach acid and reduce issues like heartburn, but you need stomach acid to absorb your protein and absorb nutrients like iron, magnesium, and B12. And actually, studies with PPIs show long-term use can actually increase your...
We're not going to take Medicare. We're not going to take health care. They took it. They said just enough to get your vote. Same thing for the Democrats. So now, the Democrats are holding steady as saying, well, we're trying to save the ACA. We're trying to save the subsidies. We want $1 billion back in so people can have their health insurance. Turns out, the people that have the majority of the subsidies are in the red states. So really, the Democrats are fighting for what the Republican base uses and needs, while the Republicans have decided, yeah, they don't need it.
Bro, this needs to be on a billboard in every single rural county in America. The data is not complicated. Red state rural Americans are the biggest users of ACA subsidies Medicaid, disproportionately red state rural hospital funding. Same exact story, and the whole time, guys in those areas are being told the other side wants to destroy their healthcare. When the lie is that clean and that effective. That's not politics anymore. That's a magic trick, and the crowd keeps buying tickets to the same show every 2 years, like clockwork.
All the while, the Republicans are telling their constituents that, well, the reason why we have a government shutdown is because the Democrats over there are trying to give health care to illegal immigrants. Now, I don't know about you, maybe in some instances, but last time I checked, illegal immigrants can't get health care or the ACA or Obamacare. They can't get it. Okay, medical treatment, yeah, but they can't get Obamacare, ACA, whatever.
Biden was trying to help over 15 million people remove $49 billion worth of medical debts from their credit report, which would have resulted in an increase in their credit scores. Estimated 22,000 people would now be able to qualify for mortgages. But here's the kicker. Trump comes in and joins the lawsuit on the side of the bill collectors. And then his little Trump-appointed judge threw the whole thing out.
Just gone. Because someone looked at all of that and decided the debt collectors needed more protection, I genuinely cannot wrap my head around that. Not as a political take, as a human one. Someone signed their name to that decision, argued it in court, went home afterwards completely unbothered. And those 22,000 families? Still renting, still rebuilding, still carrying a bill from the worst moment of their entire lives. I just keep asking myself, who exactly was being protected there? And from what?
But who is this hurting? It's estimated that 1 out of every 5 Americans has a medical collection on their credit report. It hits even harder if you are not white. We are talking about 28% of Black Americans, 22% of Latinos versus 17% of white Americans. So medical emergencies can now permanently trash your credit report. Now, this comes at a time where Trump and the Republicans have let the ACA subsidies expire. So we're seeing healthcare premiums double, sometimes triple or quadruple. Millions of Americans are about to lose their healthcare. And here's the thing, there's absolutely no data that shows that if you can't pay a medical bill, that means that you can't pay your car note, your mortgage, your rent. There's no indicator that you're more likely to fall behind on bills. Therefore, you should not be punished with a lower credit score due to medical debt collection.
Therefore, you should not be punished with a lower credit score due to medical debt collection. This is genuinely the simplest argument in this entire debate, and somehow it keeps getting buried under noise. A credit score exists to answer one question. Will this person pay back what they borrow? Medical debt answers a completely different question. Did this person get sick? Those are not the same question. One reflects financial behavior. One reflects biological reality. You don't choose when your appendix explodes at 2 a.m. Every serious economist agrees on this. Even the credit bureaus themselves started quietly removing it before all this got reversed. Keeping it on there doesn't protect lenders. It just permanently punishes people for surviving. Follow the incentive. Ask who benefits from sick people having destroyed credit forever. That answer tells you everything you need to know.
The Trump administration just issued an edict to every state, for all you state rights motherfuckers, that medical debt cannot be wiped off of bankruptcies just in time for medical premiums to skyrocket, because he's looking after the billionaire medical class and not the rest of us. I'm former MLB agent Joshua Kuznick, and I fucking told you so. This is going to affect everybody, disabled people and non-disabled people that are afflicted with health issues alike. I'm disabled, it's definitely going to affect me. Family members are disabled, it's going to affect them. Poor people, it's going to affect all of you. Disabled people, like always, they're coming for you. We all said this before this fascist, dumb regime got in there. These Stephen Miller motherfuckers. I hate them. I hate Bannon. Just remember what Kurt Cobain said in a time like this. Hate your enemies, save your friends, find your place, speak the truth. And when the Democrats offer up an option like Graham Plattner, remind them that they carve swastikas into motherfuckers' heads like that. You can't cover it up. Bomb.
I'm trying to not crash out right now. For context, in January, the Trump administration removed a rule that the CFPB put in place that would remove medical debt from credit reports. This is now taking it a step further and saying, no, if you're a state and you made a state law, which about 15 of them have, to try to make protections for patients and removing medical debt from credit reports, you can't even do that. Those are going to be overturned. I have never met a Democrat or Republican that thought that removing medical debt from credit reports was a bad idea. This is about as bipartisan as it gets. Nothing says land of opportunity like telling a cancer survivor that they can't get a mortgage because they chose to get chemo.
I need a second with that line, chose to get chemo. Like survival is a financial liability. Some guy beats stage 3 cancer, 2 years of brutal treatment, everything that comes with it, gets his life back, walks into a bank. Sorry man, your score is too low. That is what's being actively defended right now. And here's the cold reality about policies. They don't check your voter registration before they apply to you. The diagnosis doesn't care about your bumper sticker. Neither does the credit bureau. This one hits different for a lot of people watching this, and it absolutely should.
Who benefits from this? Literally the only people that benefit from this are debt collectors. We hate collection agencies. Everyone hates collection agencies, yet that is who Trump is siding with right now. Medical debt does not belong on credit reports, period. If you have a hospital bill, before you panic, before you pay, check to see if you are eligible for hospital financial assistance, hospital charity care. Hospitals are legally required to have these programs. Most of them don't tell you. We do. We're a nonprofit. We do it for free. Go to $4.org, see if you're eligible, if the system insists on being cruel. We have to find ways to fight back, and this is how we fight back. We crush medical bills for free, because you know what? A lot of these medical bills on your credit reports shouldn't be there in the first place, because hospitals were supposed to screen you for these programs.
The Trump administration just issued an edict to every state, for all you state rights motherfuckers, that medical debt cannot be wiped off of bankruptcies just in time for medical premiums to skyrocket, because he's looking after the billionaire medical class and not the rest of us. I'm former MLB agent Joshua Kusnick, and I fucking told you so. This is going to affect everybody, disabled people and non-disabled people that are afflicted with health issues alike. I'm disabled, it's definitely going to affect me. Family members are disabled, it's going to affect them. Poor people, it's going to affect all of you. Disabled people, like always, they're coming for you. We all said this before this fascist, dumb regime got in there. These Stephen Miller motherfuckers, I hate them, I hate Bannon. Just remember what Kurt Cobain said in a time like this. Hate your enemies, save your friends, find your place, speak the truth. And when the Democrats offer up an option like Graham Plattner, remind them that they carve swastikas into motherfuckers' heads like that. You can't cover it up. Bomb.
Did you know that the Trump administration is moving to ban states from removing your medical bills from your credit history? That means that if you don't pay your medical bills, your credit is going to be wrecked, completely smashed, looking at the 400s. I don't even know if it goes lower. I've never seen such horrible credit scores, but they're coming. They're coming. And what does that mean for you? Your credit score is going to be crap. You're not going to be able to get a loan. You can't buy a car. You can't buy a house. You're going to be renting forever. Not that you weren't already renting forever in this economy. So get ready, because that is coming. We are in the find out season of fuck around and find out. And I'm just sorry that the rest of us have to find out, along with the dummies who voted for Trump in the first place.
The frustration? Completely valid. I'm not going to pretend otherwise. But here's the part that actually keeps me up. The policy doesn't only land on the people who cheered for it. The hospital that closes for everybody in that county. The premium hike hits every zip code the same way. A lot of people who voted for this weren't evil. They were desperate. And desperate people make terrible decisions. That's actually what a broken healthcare system produces. Desperation, which produces bad voting, which produces worse healthcare, which produces more desperation. Mocking it feels good. Understanding the cycle is how you actually stop it.
This is your dose of daily good news from me. Goodbye.
American lives have been taken for the felon Trump's little war, and instead of monitoring what is happening to his troops like a real leader in DC, he went to Mar-a-Lago for a fundraiser. What a piece of shit. America first my ass. It's money first for him. Always. That's what happens when you vote for a draft dodger and someone who calls our military men and women losers and suckers. You'd have to be an idiot to follow any of this coward's orders.
This is actually crazy. This was fun while it lasted. Now it's official. The Trump administration is doing everything in its power to make sure medical debt is back reflecting on your credit report, especially when they go into collections.
Bobby Cole here. With the betrayal and passage of the BBB today, these Republican stuffed shirts and scarecrows don't want you to know this. With the cuts to Medicaid, you will lose your rural hospital. But what a lot of people don't realize, you will also lose your rural ambulance service. And as a former first responder, I know how vital these ambulances are in regards to medical terms. The golden hour, which means if you're having a heart attack or stroke, you need to receive definitive medical intervention within 1 hour or you will die. In regards to the Platinum 10, once that ambulance reaches your side, you need to be loaded and gone to the hospital within 10 minutes. But now the hospital does not exist, nor does the ambulance. It really doesn't matter. Just remember this, as these Republicans pile $3.3 trillion of debt on your child's head to give billionaires a huge tax break. Just thought you should know.
Let me do the math real slow so nobody can argue with it. A child born today inherits roughly $10,000 of new debt from this bill alone before they speak, before they vote, before they earn a single dollar. Meanwhile, private jet deductions survive, estate taxes get slashed, carried interest loopholes stay perfectly intact. The guy in rural Ohio who voted for fiscal responsibility, his local hospital is closing, his ambulance response time just doubled, and his grandchildren are picking up a tab for a tax cut that will never once touch their lives. This is a long con. It works because the consequences arrive years after the vote. Learn the pattern and teach it to someone.
Karma. Imagine living in the hill country, voting MAGA everywhere across the board, begging to defund FEMA and all this assistance to people that need help, especially in disasters. And then you get these Texas floods, and then you're sitting there begging for fucking help because you ain't getting it from the motherfuckers you voted for. That's called karma. It's a horrible thing to fucking say because I feel bad for all the others, but that's called karma.
I honestly can't believe nobody's talking about this. You know, H.R. 1, the bill that Trump just signed into law, well, that tax and spend bill is going to cut $1 trillion out of our Medicaid budget, and that means that millions of people will lose their access to life-saving health care. And a third of those tax cuts are going to go to tax breaks for people who own private jets. So I just sat in a meeting all day today with my colleagues from all over the country trying to figure out how we are going to take care of our patients, our obstetrical patients who in rural areas, 50% of our patients are on Medicaid. And they could lose their coverage. Their hospitals could close, will likely close, not today, but in the near future because of H.R. 1, because of these terrible tax cuts. But that's cool because, you know, tax breaks for private jet owners.
Trump is sending more Americans into medical debt. Here's what you need to know. The bill that Donald Trump just signed into law is a disaster for our nation's health. Not only will it kick 17 million Americans off their health insurance, jack up everyone's premiums, and shut down hospitals and clinics, it will push millions more Americans into medical debt. Then, to add insult to injury, Trump just blocked efforts for medical debt to be removed from your credit report. This is Trump care. Fewer people have health insurance, more people have medical debt, and more people will go into bankruptcy. So if you get cancer, if you have a sick kid or go to the ER and get a huge bill, you could be financially punished for just having a health emergency. It didn't have to be like this. This is the United States of America. We can do so much better.
We're going to get the drug prices down, not 30 or 40%, which would be great, not 50 or 60. No, we're going to get them down 1,000%, 600%, 500%, 1,500%, numbers that are not even thought to be achievable because
If you buy health insurance through the marketplace like I do, you need to hear this. New research shows that healthcare premiums are about to skyrocket by 93% on average. But if you live in rural America, you're looking at a 107% increase. That means that because of a combination of Trump administration policies, rural folks will be paying an average of $760 more per year for their healthcare premiums. And that's just the average. If you live in Wyoming or Alaska, you're looking at nearly $2,000 more a year just for your healthcare premiums. And by the way, this is on top of the 18% increase that insurers are already asking for.
Real numbers, real slow. 58 years old, rural Wyoming did everything right your whole life. Premium was $600 a month, now potentially $1,200. That's $14,400 a year before a single copay, before a single prescription, just for the privilege of having coverage. Income didn't double, rent didn't drop, groceries aren't cheaper. So people drop the coverage, they gamble, they pray they stay healthy, then they don't. ER bill goes to collections, collections destroy the credit score. Score can't be cleared anymore. Can't qualify for a mortgage, renting forever. Every single step connects, and the people who designed each step knew exactly where it led. This isn't incompetence. This is architecture.
That hurts. But here's the really disturbing thing. Rural residents are often older, they have more health issues, and they have less access to healthcare. So they need insurance the most, but they're getting hit the hardest.
Experts say that this is going to force people to go without insurance completely, and that means sicker people showing up to emergency rooms, not able to afford it, potentially choosing between life-saving care and bankruptcy, while hospitals then have to write off the cost of that care, which eventually gets passed on to you. So if you are under the impression that Trump's cuts to healthcare actually saves money, we're all about to find out the hard way.
Trump threatens mass firings if government shuts down, but I thought the Republicans had control of the Senate. Oh, hey, can you actually help me out? Actually, would you mind explaining this?
Sure thing, Nathan. We're in a healthcare emergency. Right now, people are losing their healthcare coverage, millions of Americans. Rural hospitals are shutting down, community health centers are closing. Little kids with cancer who are depending on research are just all losing out. And instead of negotiating with Democrats to get those things back for people, Republicans just want to shut the government down. Hopefully that answered your question, Nathan. Anything more?
I mean, while I have you, can you do anything about these crazy concert ticket prices? Because Gaga was so expensive.
Okay, Nathan, buckle up. We're going to do antitrust law next.
Government shutdown, government shutdown, government shutdown. It's the Democrats' fault. They don't want to work with the Republicans. That is not what's happening here. If the Republicans do not work with Democrats, tax credits for health care are going to expire this year. The average person will see a 114% increase in their healthcare premiums starting next year. Let's put this into perspective. Under President Biden's administration, they said if you're a family of four and y'all have a household income of less than $128,000, you get a tax credit to help with your insurance, which meant that you couldn't spend more than 8.5% of everything you make for the year on your health premium. Republicans refuse to work with the Democratic Party in Congress right now to extend those tax credits. For example, a 60-year-old couple making only $85K, they would see an over $22,000 increase next year on average. MAGA owns...
So here's where we land. Medical debt back on your record, premiums doubling, hospitals closing, all while the people who designed every single one of these policies will never once feel any of it. The cruelest part. None of this was hidden. It was all right there in the fine print. People just assumed it would happen to someone else. It never does. Drop a comment, share this with someone who needs the math explained, like and subscribe, stay sharp. I'll see you next time on Mind Mirror.